I want to bring in now NBC's Julie Surkin on Capitol Hill. David Drucker is a senior writer for The Dispatch. And Dr. Rob Davidson is an emergency room physician and executive director of the Committee to Protect health care. And Doctor, thanks for joining us. Going into this meeting, Dr. Menarez said this shouldn't be in any way about her. It should be about the future of trust in public health. So looking at it through that lens, what was your biggest takeaway from what you heard today?
I think she represented that perfectly. I think she didn't get personal in how it made her feel, or she did say she could have kept the job and, the power that comes with it if she was willing to abandon the principles of trust in public health. And she wasn't willing to do that. And I also have to thank Senator/Dr. Cassidy for the closing statements and his, full-throated support of the Hep B vaccine for newborns and what it's done over a couple of decades. I think the whole thing shed light on, really, this bolstered the case that vaccines have been tremendously critical in saving lives, and we should continue to support them.
Cassidy has been at the forefront of discussing this as a physician, as a lawmaker. Julie, this hearing was also notable because it gave Dr. Menarez that chance to respond to Secretary Kennedy, who said that she had told him herself that she's not trustworthy. Menarez said that that's not exactly what happened, that she says that Kennedy was the one who said that he couldn't trust her. So this seems like a he said, she said moment. How is all of this falling with lawmakers that you are talking to on both sides of the aisle?
It does, Ariel, and we heard that moment kind of play out in real time when Markwayne Mullin, a Republican senator, was questioning her about her timeline when she retained counsel, when she was fired, when she let go of political appointees. And he also mentioned a recording of that exact conversation that you just brought up, where RFK Jr. accused her of not being honest, of saying that she was not trustworthy. There was some back and forth there with Senator Cassidy, who's the top Republican on the panel, of course, chairing and gaveling in this hearing. Apparently, Mullin said that he did not mean there was a recording. He meant there was a transcript. That would be significant because why in the world is a conversation between those two being recorded in the first place? So we'll put that on the side for now because they said it was a misunderstanding. But more notably here, I was struck by the final closing words from Senator Cassidy. And you already heard that he was a doctor. He has his own experience in this. He said, anything less than radical transparency betrays the mandate the president delivered. He was trying to make way to what the president had promised, transparency throughout his administration. In this case, it is why Menarez came before this committee. It is also why Deborah Oury, who was the former chief medical officer who worked with Menarez at the CDC, that's why she left. She said in solidarity with Menarez because she did not want to be politicized. There was a crucial exchange between her and a Democratic senator on this very topic. Watch this.
Would you say that it's harmful to the public if the secretary is not informed by experts like yourself?
Very much so.
How would you characterize Secretary Kennedy's approach to working with scientific experts at the CDC?
We would have loved to have had the conversations with him. I offered to 2 different HHS leaders that we would like to brief the secretary. He never received that, and many times I would send emails to our leadership team to share with HHS when he did say things that weren't scientifically correct so that we could help support him. But our requests were not received to brief him.
Ariel, there is clear public distrust of vaccines, of our public health system. This is something that lawmakers on both sides of the aisle want to restore confidence in, especially after the COVID-19 pandemic that helped erode some of that trust. And you did hear some politicization in this hearing today. You heard some Republicans try to question her on her timeline, try to question her on her facts, also trying to question why she went to Cassidy, who is the Republican chairman of this panel, in the first place. Cassidy, I thought, was notable in defending her. He said it's completely appropriate, his words, as the committee that has oversight of the CDC, the HELP committee, in which this hearing is taking place, for people to go and try and sort of sound the alarm on what is happening behind the scenes. And Cassidy mentioned this came at great public risk to Menarez and to Deborah Oury to come and sit before this panel amid such a heightened moment of politicization and polarization in this country, Ariel.
Certainly in the environment and the climate we are living in. Julie, thank you for your reporting. I know you have more to do, so we'll let you go here. Doctor, I do want to play part of an exchange about the childhood vaccine schedule. Let's listen to it. I want your thoughts.
We got into an exchange where I had suggested that I would be open to changing childhood vaccine schedules if the evidence or science were supportive. And he responded that there was no science or evidence associated with the childhood vaccine schedule. And he elaborated that CDC had never collected the science or the data to make it available related to the safety and efficacy.
To be clear, he said there was not science or data, but that you still expected you to change the schedule.
Correct.
Okay, there was another exchange where Republican Senator Rand Paul said that, in fact, the burden should be on the CDC officials to justify not considering changes to the vaccine schedule. This is getting incredibly convoluted. Just react to it from your medical perspective.
Yeah, I mean, I think she's representing, truth and science and research well. Research and science is incredibly nuanced. We heard from Dr. Oury that Secretary Kennedy didn't want to meet with the experts, right? He came in with a certain fixed set of beliefs about vaccines, some of that maybe based on his personal beliefs, some of that based on how he has profited as a lawyer in lawsuits against vaccine manufacturers, some of it about his political rise because of the movement he brought to Trump to get elected. And so it's incredibly frustrating to hear. I did listen to, Senator Marshall say, well, you have a belief system and he has a belief system, and he did some strange, thing about a football coach and an athletic director having different visions. Like, this isn't a belief system. This is her basing it on facts, on what we know, on Senator Cassidy telling us that 20,000 babies contracted Hep B 2 decades prior and then down to 20. I mean, it's hard to even address what they're talking about because it's just not based in reality. And I really appreciate how she and how Senator Cassidy refuted that.
David, some very interesting dynamics at play here. It's been noted that the president wasn't the one to actually go out and fire Menarez like he's done with previous officials. It raised some questions about whether he and Secretary Kennedy are on the same page here. But today, Menarez said that they had talked every day and specifically about changing the childhood vaccine schedule. So knowing all of this, what are the chances that Republicans, perhaps like Cassidy, have any sway with the president when it comes to RFK?
Slim to none. But I'd look at it on two tracks here. It's possible that there's a lot of Republican concern about Secretary Kennedy's leadership of HHS and how he's handling the vaccine issue, and that they're communicating with him and pleading with him privately. And that's the most effective way to have influence with President Trump when you disagree with him or have personnel concerns in his administration. There's certainly not going to be much of a public outcry from Republicans about this, in part because that is the surest way for President Trump to reject the concerns that Republicans clearly have about Secretary Kennedy. But also, it's just possible that they're just going to defer to President Trump regardless. There isn't right now a big political backlash against how HHS is handling this issue or against Secretary Kennedy. The president has shown a lot of support for Secretary Kennedy. In part, that has to do with the fact that I think he likes having a Kennedy of the famous Kennedy family in his cabinet. Kennedy also brought a lot of voters to the table. There is a faction of voters that is not insignificant that shares Kennedy's skepticism and rejection of vaccines, that just doesn't believe that they do what we know they do. And so trying to have a debate here on the science is not really, how this is going to change matters. I think the way this changes is if voters get upset. And I don't know that voters get upset if and until we get to a point where the ramifications of how Kennedy is handling this end up developing, giving voters a real reason to question what he's doing.